Did you know that one of the greatest medical breakthroughs was discovered almost by accident? Surgery used to be terrifying. Patients were fully awake, in pain, and often restrained. Surgeons had to work quickly before the patient fainted or struggled. Every operation was a gamble, not just for the patient, but for the surgeon too. However, everything changed in the 19th century thanks to one dentist whose curiosity led to the discovery of anesthesia. Our hero, William Morton, was a dentist in Boston in the 1840s. Of course, he could not help noticing that dental work was excruciating. Patients had no way to escape the pain of tooth extractions. He was determined to find a solution to alleviate his patients' suffering. He first experimented with nitrous oxide, also called laughing gas. While it made people giddy and lightheaded, it wasn't strong enough to fully block pain. But Morton didn't give up. He learned from chemist Charles Jackson about ether, a chemical known to make people lose sensation when inhaled. Experiments had shown that ether could dull awareness and induce unconsciousness, but no one had ever used it in serious surgery. Morton realized this could be revolutionary. If he could use ether safely, he might finally make pain-free surgery possible. Morton didn't rush to try ether on patients. First, he tested it on himself. Inhaling ether vapor, he noticed he became unconscious for a short time and then woke up safely. He even tested it on his dog. These experiments gave him the confidence to move forward with human trials. In 1846, he gave the first successful public demonstration of surgical anesthesia. Morton used ether on Edward Gilbert Abbott, who required the removal of a neck tumor. The ether rendered Abbott unconscious during the surgery at Massachusetts General Hospital in Boston. The operation was performed by the surgeon John Collins Warren. When the procedure was complete, Abbott had not felt any pain. Dr. Warren then turned to the astonished audience of doctors and declared, "Gentlemen, this is no humbug." This single moment marked the birth of modern anesthesia, opening the door to safe, pain-free surgery. While others had experimented with substances that dulled pain, Morton's demonstration proved for the first time that anesthesia could be safely and reliably used in real surgery. It is important to note that Morton didn't have modern equipment or guidelines for dosing. He relied on careful observation. Watching his own reactions to ether and later his dog's, he learned how much was needed to induce unconsciousness safely. For patients, he started with small doses and monitored them closely, checking their breathing, skin color, and responsiveness. Only when the patient was fully unconscious did the surgeon begin. Early anesthesia required skill, patience, and constant attention. After Morton's demonstration, news spread quickly. Some doctors were skeptical and early delivery devices were basic, but hospitals in the US and Europe soon began using ether. Later, chloroform was introduced as another option. By the early 1850s, anesthesia had become a standard part of surgery, transforming operations from a terrifying ordeal into a mostly pain-free experience. The discovery saved countless lives and forever changed the way medicine was practiced. What started as a curious lab experiment led to a global medical revolution. Thanks to Morton and the accidental discovery of ether's effects, millions of patients could finally undergo surgery without suffering. The discovery of anesthesia didn't just change surgery, it transformed medicine and society as a whole. Suddenly, doctors could perform longer, more complex operations without the patient screaming in pain or risking shock. Surgeries that were once impossible became routine. Anesthesia also led to the development of modern hospitals and surgical techniques, allowing doctors to focus on precision rather than rushing to minimize suffering. Millions of lives were saved, not just from the surgery itself, but from the ability to treat conditions that were previously untreatable. Beyond medicine, anesthesia changed people's perception of medical care. Fear of surgery decreased dramatically, making patients more willing to seek treatment. It paved the way for advances in obstetrics, dentistry, and emergency medicine, shaping the modern world of healthcare we know today. In short, anesthesia didn't just relieve pain. It redefined what medicine could achieve, making surgery safer, more humane, and far more effective.